Welcome to NNLM Reading Club Presents, a series of online discussions with engaging authors writing on health, health information, and health equity. This is the second talk in our series. I am Darlene Caskey, All of Us Community Engagement Coordinator for the network of the National Library of Medicine, Greater Midwest Region, located at the University of Iowa. I'm also your host today, and in assisting me are members of our NNLM team, Michelle Spots, George Strawley, and Maddie Romancic. A few housekeeping items. Please know this program is being recorded for future viewing, and know that you are muted. However, we'll be monitoring and responding to your questions in the comment section. Our event is available in closed caption. To access the captioning feature in YouTube, click on the CC logo on the bottom right of your screen. If you have any difficulty with the captioning or other technical issues, please use the comments section to let us know. Today's presentation is part of the NNLM Reading Club Presents, an author discussion series to explore books on topics related to health and health equity. These programs take place about once every other month. And the author series is built on the NNLM Reading Club, a monthly selection of book titles to help libraries support health information needs in their communities. Each month, 3 books are featured, including free and downloadable material, such as discussion guides and health and wellness information from the National Library of Medicine and other trusted resources. We encourage you to use them in a discussion group or read them on your own. To find the NNLM Reading Club health topics, book titles, and discussion guides, visit nnlm.gov/all-of-us/NNLM-reading-club. In July, the NNLM Reading Club topic was racism in health, with a special focus on Black maternal health. We Live for the We was one of the 3 featured books. Other titles were Battling Over Birth, Black Women and the Maternal Healthcare Crisis, published by Black Women Birthing Justice, and Motherhood So White, a memoir of race, gender, and parenting in America, by Nefertiti Austin. And our series is possible because of the All of Us research program under the National Institutes of Health. The mission of All of Us is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. The program aims to build one of the largest, most diverse data sets of its kind for health research, with 1 million or more volunteers nationwide who will sign up to share their information over time. We welcome you to learn more by visiting joinallofus.org/NLM. And now for our feature presentation. Moderating today's talk is Andrea Collier. Ms. Collier is an award-winning multimedia journalist and author of 2 books, Still With Me, A Daughter's Journey of Love and Loss, and The Black Woman's Guide to Black Men's Health. She also is part of the Black Women's Health Imperative. The organization is dedicated to promoting physical, mental, and spiritual health and well-being for nearly 20 million African American women and girls across the nation. And our guest author, Dani McClain. She is an award-winning journalist who reports on race, parenting, and reproductive health. She is a contributing writer with The Nation and a fellow with Type Media Center. Her writing has appeared in Slate, Color Lines, Ebony.com, The Rumpus, Guernica, The Atlantic, and The New York Times. Her work has been recognized by National Lesbian and Gay Journalists Association, the National Association of Black Journalists, and Planned Parenthood Federation of America. In 2018, she received a James Aronson Award for Social Justice Journalism. The award recognizes writing that addresses widespread injustices, their human consequences, underlying causes, and possible reforms. Finally, but not least, she has worked as a strategist with organizations including Color of Change and Drug Policy Alliance. Today, we're fortunate to have Ms. McClain discuss her book, We Live for the We, The Political Power of Black Motherhood, which was published last year by Bold Type Books. It's a finalist for the 2020 Hurston Wright Legacy Award in Nonfiction. Welcome, Dani McClain. To you, Andrea.
Thank you, Darlene. I'm really excited to be talking to you, Dani, after reading the book and getting so excited about the thoughts that you are sharing with all of us, especially at this really important time.
Thank
Let's
you
just
so
jump,
much. I'm equally excited to be with you.
let's just jump right in. What drove you to dig into the subject at this particular time?
Sure. So, 8 years ago, at the end of 2012, I received a reporting fellowship to cover reproductive rights. And so this was a new beat for me. I had covered education in the past. I had, been a journalist for a while, but the idea of covering reproductive rights was really different. And so I looked to see how other journalists had covered that beat. And what I noticed was that most were covering the politics of abortion and contraception, which of course is incredibly important. But I started learning from mostly Black women, but certainly people of color who were in that reproductive rights space, who introduced me to something called the reproductive justice framework. And what they taught me was that reproductive justice was a human rights framework that was founded in 1994 by Black women, and that it's a set of principles that asserts the right to have a child, the right to not have a child, and to the right to parent the children that we do have in safe and healthy communities. And what was interesting about that to me was that, the coverage, the kind of approach to the beat that I had seen was covering the right to not have a child, right? Abortion and contraception. But there weren't many people covering this idea of like we have the right to have children and to parent them, with dignity and in safe and healthy communities. And so I set out to create a beat that covered all of those things. So I think it's important to mention that because the book is rooted really in the reporting that I had spent the previous 7 years, doing, covering reproductive justice organizing. More specifically, though, this particular book project, I would say it was really born the summer of 2016. Um, I was pregnant with my daughter. She's my first and only child. So I was pregnant with her, and I started reporting a story on the maternal health crisis. At that point, I had heard the statistic that Black women were 3 to 4 times more likely than white women to die from complications related to pregnancy and childbirth. But I just kept seeing that stat all over the place. I wasn't seeing anything about why. And so I set out that summer to try to find out why. I had also noticed that, people often talked about the US maternal health crisis, but it was very obvious that this was something that was affecting Black women. And as I would dig a bit more deeply, I would learn that it was affecting Indigenous families as well. So that's really kind of the origin. I was reporting this story. So I was reading, medical literature. I was interviewing OBs and midwives. And I was also going through my own experience of being a Black woman, going to prenatal appointments in Dayton, Ohio, seeking out birth support that I felt good about, that was culturally congruent, and really struggling to find that. And so I wrote a story that ended up running in The Nation, that pulled together my own personal experience with the deep research and interviewing that I had done over that summer. And I think it's also important just to mention the political context of that moment. So it was the summer of 2016. I'm someone who's always glued to the news, both because that's my job and also because of personal interests. And that was the summer that Philando Castile was killed by police in the Twin Cities. Alton Sterling was killed by police in Baton Rouge, Louisiana. It was the presidential campaign season. And so there was a lot of xenophobic and racist rhetoric, white supremacist rhetoric that was being whipped up on the campaign trail. I remember watching the Democratic National Convention and the Mothers of the Movement, which were the mothers of people who had been killed either by um, police officers or vigilantes. So it was the mother of Jordan Davis, the mother of Sandra Bland, the mother of Eric Garner, and other mothers who were gathered on the stage there at the DNC to talk about their efforts to really combat state violence. And so that was the context. It felt important to write a story that touched on issues of maternal health, put it in the context of what it means to give birth to and raise a Black child in this moment, and connect it all to the reproductive justice framework.
Well, fast forward, whatever you thought was happening in 2016 has just been amplified. The party is on.
Exactly.
So, and we also know that the numbers are not new on the side of the killing of young Black men, or on the side of having equitable health care and maternal child health for people of color. So do you think it's finally getting, either one of these, both of them, are getting the attention that they deserve to the point that people finally get it?
I so appreciate that question, because in preparing for this conversation, I had to like reach back to 2016, and it feels like 20 years ago somehow. In some ways it feels like just yesterday, in other ways because of even just how full this past summer has been with a pandemic and with uprisings all over the country. In so many ways it feels like so long ago. So I think a couple of things have happened in terms of public attention to the maternal health crisis. Yes, I think things have changed a lot from 2016. So that story that I wrote for The Nation, it ran in February of 2017. And, you know, we've had so much incredible coverage of the Black maternal health crisis since then. One important thing is, as I mentioned, I think we used to talk about the US maternal health crisis, and the story was framed as like, how can the United States, you know, this country that is, you know, a leader of the Western industrialized world, how can so many women be dying in pregnancy and childbirth? Now, I think this story is framed as it's the Black maternal health crisis. We speak very explicitly about the Black maternal health crisis. And so that's, I think, a change that's happened in the past 4 years. And I think that's come about because of the coverage in prestige media outlets. So you had the series, the really strong series that NPR did in partnership with ProPublica. And one of the people featured in that series was a woman who actually worked for the CDC, you know, who died shortly after giving birth. And I think the people who they highlighted through that series really shook a lot of people up, you know, into a recognition of what's really happening, that we can't talk about this as a class issue. I think for so long, this has been framed as like, oh, well, Black women are dying disproportionately because they're disproportionately poor. It's about poverty. And I think through so much of this coverage, as well as people like Serena Williams and Beyonce and all these Black celebrities, you know, global celebrities coming out and talking about having not been listened to while they're experiencing certain, you know, health issues during labor. I think that's also helped people wake up to the fact that we need to talk about white supremacy, and we need to talk about racism head on when we talk about this issue. So I really credit, you know, I'm proud of the reporting that I've done. I credit Nina Martin at ProPublica and the work that she did in, you know, in partnership with NPR, the incredible New York Times Magazine cover story that Linda Villarosa did. I mean, you know, I grew up reading Linda Villarosa in Essence. Like, she was like the health editor at Essence when I was a preteen. So to see her write that story for the New York Times Magazine made my heart sing, with the incredible photographs by Ruby Fraser. I'm going to blank on her full name, but the incredible Black photographer who captured the story as well. So I think some of it is about media coverage, and it's about the fact that we are being encouraged to look at this issue head on. The other books that were featured alongside my book for the reading club, I mean, I really value the work that Black Birthing Women's Circle is doing in the San Francisco Bay Area. Nefertiti Austin writing about being an adoptive mother. I just think that there's been this kind of flood of both journalism and books about the experience of Black birth, and also about the experience of Black motherhood. So, and then there's movement, right? I mean, the second part of your question was, how has public perception shifted around state violence against Black bodies? And a lot of the reason that we're paying more attention to that is because movement has forced us to pay more attention to that. When you have people in the streets, when you have when you have people, I watched the National Black Political Convention online a couple of weeks ago. And so it's not all direct action. It's not only direct action. It's also cultural organizing. It's also an effort to shift culture and shift conversation around why are so many Black people dying at the hands of the state or vigilantes who show some kind of allegiance to, white nationalism. And so I'm really heartened by the conversation that we're having. Of course, the content of the conversation is devastating, but I'm glad that we're having the conversation.
Well, we know that this has been going on forever, but we also know that having a George Floyd die basically in people's living rooms,
right,
is something that people said that doesn't exist. Well, they can't deny it if they see somebody put their foot on somebody's neck or choke them, and to see them die. What do you think are some of the things that need to really be lifted up and come up out of this?
Mm-hmm. Well, I would say one of my greatest learnings in reporting this book, specifically the first chapter, which is really about birth and pregnancy and birth, I really appreciated learning more about Black birth workers. So when I first started reporting that story, I called Monica Simpson at Sister Song, who is somebody who has been a source in my stories. Sister Song is a reproductive justice organization that's based in Atlanta. And she told me, if you want to look at the Black maternal health crisis, you need to talk to Black birth workers. And what I quickly learned was, if one of the problems is implicit bias, one of the problems is white supremacist, racist beliefs that the medical community holds about Black people, which gets in the way of them actually really hearing us, taking our complaints seriously. If that's a problem, then what happens if we look at the relationship of a Black birthing person and a Black OB or a Black midwife or a person who is birthing with a Black doula at their side? How does that change the experience? And so there's a phrase that I learned from a midwife who works with the George Washington University Health System in DC. Her name is Anaya Shangodole Ayoka. And she used this phrase, cultural congruence. And she talked about, she's a midwife, and in this practice, I think she told me she was one of 2 Black midwives. And maybe in their practice, there are like a dozen midwives. And she said, whenever they do that, meet the midwife, kind of open house. I attended many of those when I was pregnant. And when there are Black families who attend, afterward, they all line up to talk to her or the other Black midwife. And she said, that's because people want to feel culturally congruent. They want to feel like they are working with somebody who they can speak honestly, not only who will see them as a human being, who will listen to them, but also with whom they can be honest. And so I just felt that some of the examples that she used were so telling. So she was talking about, there are all these assumptions that are made when we're pregnant, that we have access to good, healthy food, that we don't live in a food desert. So she talked about if someone felt like maybe they needed to disclose, I'm actually having a problem accessing the food that I need to get, during this pregnancy, that they might feel more comfortable sharing that with her. If people have questions, say they're cannabis users and they have questions about cannabis and pregnancy or cannabis and breastfeeding, would they feel more comfortable with a Black provider than they would with a white provider who they might think, or a non-Black provider who they might think, is this person going to call child welfare services? Like, what are the disclosure requirements? Or, and I have a question that's based in my health and wanting to keep myself and this fetus healthy. But I might not feel comfortable asking the question if I don't feel that there's trust, between myself and my provider. If there's abuse going on, intimate partner violence, these are the kinds of things that she was helping me understand, that cultural congruence can kind of ease a situation and make the relationship between a provider and a patient that much better. And I just want to, there's something that I like to mention when I talk about this, because I think for some listeners, it can be like, well, why is there this assumption that a non-Black provider would be so judgmental or would, not like hold this Black birthing or pregnant person in high esteem? When I was doing my research, there was one study that I came across that has just stuck with me and that I will never forget. It was a 2016 study from the University of Virginia that found that about half of white medical students and residents were, when they were surveyed, they held at least one false belief about Black bodies. So for example, that Black people's nerve endings were not as sensitive as white people's. I just think this is so telling, right? Because this wasn't a survey of just like people on the street. These were people who had already received some medical training, and they still hold these totally wrong ideas about physiology, right? So these are, and I write about this in my book, the kinds of gymnastics, acrobatics I would go through trying to outthink what are the perceptions of me as a Black woman, and how can I try to challenge those perceptions through how I'm presenting myself so that I get the care that I need, right? So I just wanted to make that point, because I don't want to be I want to root this conversation in something like we're not just like hallucinating or like we're not being paranoid. There's a lot of data that shows that our fears are well-founded. But back to your, the question was like, what could come out of this as a solution? I think we need to look more closely at what Black birth workers are doing. I think, as Monica Simpson told me, as she kind of encouraged me along a certain reporting path, like if you take implicit bias, as we call it, as people are calling it these days, if you take that out of the equation, how do the outcomes change? And I think that that's something we need to look more and more closely at.
Well, you talked to people in Detroit at the WIN Network who are trying to do some things like healthy baby and more support. And what did you learn from them?
Yeah, I was so glad that I found Dr. Kimberly Dawn Wisdom is her name. I happened to just meet her at a conference that I went to, and I learned about the work that they were doing at the Henry Ford Health System, that they were doing group prenatal care for women who are at high risk for preterm labor. And so what this meant was that, when you go in for a prenatal appointment, or at least in my experience, I would go in for a prenatal appointment with my OB, and they would like check weight and look at my stomach and all these things. And then when there was time left, I would ask whatever questions I had. I'm experiencing this. What do you think about this? Now, in a group prenatal setting, all of those kind of the weight taking, weighing and belly measurement and all of that happens. But then the conversation is a group conversation instead of a one-on-one conversation between the patient and the provider. And what that allows for is you're really learning not only from, it's not like this hierarchical thing where it's the provider is the holder of all the information and you're the recipient, is that you can really teach each other. The provider is also there, so you have the expert in the room, but maybe you didn't think to ask that question that the person sitting next to you asked. And, oh, I had forgotten to, I also was wondering about, what is preeclampsia, or I have fibroids, what should I be thinking about? And I had totally forgotten to ask that question. I'm so glad she did, right? So what they found was, so they instituted this group prenatal care, but they were also connecting women with community health workers who could help them with things like some of what we were just speaking about, like access to healthy food, stable housing, reliable transportation. And so the hospital system was providing people with this kind of circle of support. And that was a phrase that came up again and again in my reporting, like this idea that everybody needs a circle of support as you're, pregnant. And also in the postpartum period as well, people to continue to check on you and make sure that you're not trying to do it all by yourself. Even if you are partnered, or even if you have a parent helping you, is something, giving birth, being pregnant, and being in that postpartum period, you need a circle of support. So what the Henry Ford Health System was doing was just an example of a large healthcare system that was trying that. And their outcomes were really incredible. Of the 25 babies who were born to participants in this pilot, this was in 2016, none of those babies were sent to the NICU, the neonatal intensive care unit. And of the mothers, none of them were sent to the ICU. They all started breastfeeding and they were all connected to lactation support. So that's just one example of, you know, a way that an institution can support healthy outcomes. I heard about that kind of thing a lot when I would talk to midwives, for example. I interviewed somebody named Tamika Middleton in Atlanta who talked about how beautiful her pregnancy and birth were because she had the support of a Black community-based midwife. And the circle of support there were just other families that had given birth with this particular midwife. Often when I heard about these circles of support that were culturally congruent and really helpful, they were something that someone had just kind of like fallen into. It was because they were working with a midwife, because they were doing their process outside of the hospital or outside of the medical system. So it was a real, it was nice to find out that this kind of support could also be offered by a major healthcare system.
Let's check in with Darlene to see if she's got any questions from the audience.
I have not received anything yet, but I do have a question, if I may. Can you tell us a little bit more about the title of the book? It seems like as you talk about the health systems and people coming together, maybe that might help explain your title of your book.
Sure. So yes, thank you for that question. We live for the we. So, I mean, as I'm speaking of in the context of pregnancy and birth, and I'm talking so much about community, right? The circle of support and having people who can kind of check in on us, who can help us in these, what can be a challenging process. That idea of community came up again and again throughout my reporting process, no matter what I was asking about. So the first chapter of the book, for those of you who have read it, you know that it's about pregnancy and birth, but I go on in the subsequent 8 chapters to touch on a number of different topics, from setting up a culture in my home that I felt would be, you know, good for my child and for our family, to choosing early childcare spaces for her, you know, preschool, anticipating what it'll be like to choose a K-12 placement for her. There's a lot about education in the book. I get into talking about the body and sexual health. These were questions that I'm anticipating, you know, will come up when she's a teenager. And for those questions, I turn to people who have parented, you know, older children. There's a chapter about spirituality and giving our children a grounding in spirit and kind of like a moral compass. And then there's a chapter, the final chapter is about, really, it's the most explicitly political chapter. And it's really about organizing. And in some ways, it's also about electoral politics and how do parents make the decision about how and when to pull their children with them into expressing their politics and activism. And so one of the things that came up again and again, no matter what I was asking people about, was the importance of community. I was interviewing someone named Kat Brooks, who's an activist in Oakland, California. At the time that I interviewed her, she was running for mayor. And she said, so Kat does work around, she supports the families of people who have either been killed or badly hurt by police. And so she's someone, Kat is a major public figure in the Bay Area. And so she was saying that she's often at meetings, and she has a daughter. At the time that I interviewed her, her daughter was 12. She was saying that they're often at meetings and rallies or, you know, supporting other families, and that her daughter would sometimes say to her, can we, you know, just have dinner, just the two of us, or can we go to Disneyland, just the two of us? This was in the before times when people did things like go to Disneyland. Mm-hmm. And Kat said, I tell my daughter all the time, and it's harsh, but we don't live for the I, we live for the we. Mm. And when she said that, it was such a powerful moment. I had been going back and forth with my editor, who was pressing, what's the title going to be? What's the title going to be? I don't know. And when she said that, I was like, I think that's the title, because, excuse me one second. Whether I was interviewing somebody or digging into the canon, the kind of Black feminist literature about motherhood, Patricia Hill Collins, Audre Lorde, these Black feminists whose work I was really trying to root my own work in their tradition. This idea of the community aspect of mothering that Black women and Black families have always held, it was just so strong. And so, Patricia Hill Collins talks about community mothering and other mothering, and this idea that we parent our own children, of course, and we have an eye out for not just our children's needs, but their peers' needs as well. Because if our children are being discriminated against at school, or if we can't find good healthcare for our children, we know that their peers are facing the same things. And so when we advocate, we're advocating not just on our children's behalf, but on, behalf of other families as well who are in our same situation. And so when Kat Brooks said that, I tell my daughter all the time, we don't live for the I, we live for the we. It just pulled together both what I was reading and what I was hearing from my sources.
And I think anybody that writes or is writing booklet manuscripts, that is like the bridge that you're writing and like, I gotta call it something. And
Right.
once you come up with the name that seems perfect for it, it helps structure and move the work forward.
So true. That's so true. I'm so glad you said that, Andrea. I was like, because I didn't know this about publishing, but the conversation about the title, I think it started, it was like one of the first things we talked about. And I was just like, this isn't fiction. Like, I'm not just imagining what this book is going to be. I have to report it. I don't know what the title is going to be. But it's critical in the marketing and the publicity of the book. It has to have a title that really grabs people. And so, yes, that was just like one of those moments that I prayed for, that here's this source saying these brilliant things and also giving me the title.
And then again, you're used to doing magazine and publishing, that kind of publishing work, as am I. I don't spend a bunch of time thinking about the title in a magazine piece because they're going to change it anyway. Exactly. That's for right. All of you who don't know that. We don't always come up with these titles. Somebody else might. Right. But it also brings, I would be remiss if I didn't bring up the fact that this past weekend, we lost Ruth Bader Ginsburg. And by every account, a true feminist. What do you think what makes you cringe and scary? What's scary about not having that kind of advocacy at the top for reproductive rights? Because let's face it, if the court gets any more conservative, some of the things that you are writing about are going to change, perhaps.
Yes. I really had to take a moment on Friday when I heard the news of her passing to remind myself, she's become this feminist icon, in recent years. And so, notorious RBG and this and that. And I had to remind myself, because my mind immediately went to the political fight that I knew would be around the corner. And my mind immediately went to Merrick Garland and precedent that had been set back in 2016. So I had to take a moment just to remind myself to appreciate Justice Ginsburg as a human being, and like, her family is grieving, and this isn't just like about a political fight. We just lost this incredible human being. And I've so appreciated the stories that have happened in recent days about, her founding the ACLU's Women's Rights Project, and just the stories about her career, her long career as a jurist. And so, what am I thinking about? Andrea, to be totally frank with you, I feel that we're in this moment where the news comes so quickly every day
Yes.
that, you know, that I try not to get too ahead of myself, because as the mother of a 4-year-old and someone who's trying to write a lot of stories on a lot of different topics and has the privilege of being in public conversation with people like you, every day I'm trying to put one foot in front of the other. That's all I can do to try to make it through these times. And I am not involved in the battles that are taking place on Capitol Hill right now. So all I can do is trust that there are smart people with their hearts and minds in the right place, trying to get this country to a better place. But what you said is absolutely right. You know, the future of Roe hangs in the balance. And like everything else, I turn to the people. I'm very clear that I'm a journalist. You know, I think because I wrote a book, sometimes people try to put me in an expert slot. And I'm like, I don't have the expertise that I have at this point is because of my reporting. And it's so critical that I keep reporting. I'm not trying to rest on any laurels at this point. And so until I sit down and do, you know, interviews with reproductive justice and reproductive rights advocates who are on the front lines right now, trying to figure out what's going to happen, I don't have anything smart to say, because I'm an observer, just like the rest of us are.
Yeah, I can get that. And sometimes in terms of self-care, I just decide I'm going to stop watching for a weekend or something. And in my office, if I turn this around, you would see I have 3 different big screen TVs that are almost always, I'm embarrassed to say, on the news. So I turn them off, and then my husband comes rushing in with some awful news that I really don't want to hear. I'm like, thanks a lot, buddy. What do you think that Black women can do, need to do as a community or as communities to support each other in their health, in their mothering, in their thinking, and their being there for each other? Because we also know that people are not always all right these days.
Yeah, right. Yes. One of my great joys in having written this book is that I've gotten to travel around the country, because I feel so lucky that my book came out in April of 2019. I really do. You know, when these stay-at-home orders went into place, I had a lot of friends whose books were coming out in the spring, and I just thought, because one of the best things about writing a book is then you get to take it on the road if you're lucky, if you can find the budget to do that. And I really enjoyed being in conversation with groups of Black women. And so I did an event with the Bloom Collective in Baltimore, which is a group of Black women who offer birth support to the community. There's a project called the Postpartum Justice Circle, I think they're called, in the San Francisco Bay Area. But all over the country, there are these, again, circles of support that are these community-based organizations that are doing education, you know, birth and pregnancy education for one another. They involve, you know, they include doulas and midwives for sure, but they're also just people who have become parents and so want to share their own experiences with each other. And I think that that's something that's really critical that we're doing. And to be clear, we've always done it, you know, just because we're like calling each other cute names now, calling these groups cute names now, doesn't mean that they haven't always existed. So I think that that's what we can do. These, you know, again, these culturally relevant circles of support. You know, one of the things that's really occurred to me is that this came up again when I was touring the book. I had, every once in a while, a young person would come up to me and say, sometimes it would happen, the person would have tears in their eyes and they'd say, I always thought I wanted to have a kid, but I am hearing you talk about your book and I'm hearing all these news reports and I'm terrified. I don't think I want to do it anymore. And this came up, I did a conversation with Latham Thomas, who's a doula in New York City. Mama Glow is her brand, her project. and she said she's been hearing this a lot as well in the past couple of years. This is the dark side of, you know, the kind of negative side, I should say, of all of this publicity around the Black maternal health crisis, is that people are frightened. And I think people, some young folks, I think it's affecting people's reproductive decision making. You know, they're hearing the horror stories, they're hearing what could go wrong, they're hearing about people's negative interactions with their healthcare providers, and they're thinking, I'm too scared to do this. Maybe I won't have kids after all. And so, in one of the things that I think that we also need to be doing with each other is giving each other hope and sharing the positive stories as well. You know, talking about, for those of us who find great joy in parenting, you know, or talking about, listen, I didn't have a doula, you know, during my pregnancy, but I had a postpartum doula. And, you know, so in my own experience, I did have a postpartum doula for the 2 weeks after I gave birth. And it was my closest friend, someone who I've known for 25 years. And talking about the support that I did have, right? So it's not just a narrative of doom and gloom. So those are just a few ways that I think that we can support each other.
My last question, and then I have Darlene come in and tell us if she's got anything else. My last question is, what's next for you?
You know, I am really excited about the work that I've been doing in recent months, and that I'm doing right now. You know, I've been just leaning into this reproductive justice beat, and now my child is 4, and so I'm not writing quite as much about pregnancy and birth right now, but I'm writing a lot about education. I wrote a school about Black homeschool, a Black homeschool collective in the Cambridge area that was very interesting. I just wrote a story, that piece was for the New York Times parenting section. I just wrote a piece for The Atlantic that's about how educators, specifically those that work with young children, talk to them about police and racism, and kind of how can we use age appropriate techniques to teach young people about these issues. I'm working on a story about really kind of these, to be honest, divisions within the reproductive rights world between, you know, people who kind of argue for this like colorblind approach to reproductive rights with a focus on the kind of freedom to not have a child, right? The divisions, kind of age-old divisions between that camp and the camp that says, yes, I deserve my right to not have a child, but also can we talk about my social and economic rights that will give me what I need so that I can raise this child well. So I'm like, you know, again, it's, in some ways I'm just finding different ways to tell these stories about the same issues, which is Black women, Indigenous women, women of color, advancing our specific, the ways that we live womanhood and live, you know, our dreams around what our families can look like. And that is not always the same as a white middle class story about what it means to be a woman or what it means to build family. And my hope is that what I do is that I tell these stories and lift up these voices in a way that is not divisive or like playing into these narratives that like we're just being mean-spirited or something, but instead really point out, you know, how we got to today, how there's a whole history around race and gender and how it's lived in this country, which means that we're going to experience pregnancy differently. We're going to experience sending our kids to school differently, right? And that doesn't, where our stories are no less legitimate and they need to be centered as well.
Well, I, for one, as a Black woman of a certain age, am really happy that there's a Dani McClain out there telling these stories.
Thank you so much. That means a lot.
Darlene, what you got?
I think our audience might appreciate hearing a small passage from your book. Would you mind? We have about 5 minutes left. Would you mind reading something from your book?
Sure. Okay. Well, I'll just read from the beginning of the chapter on birth. So I may have said some of this as we spoke, but hopefully it won't be too repetitive. It's a Sunday afternoon in July 2016, and I'm lying on my bed trying to calm down. The month's rapid fire events are hitting me square in the gut. Today, someone agitated by police shootings of Black men ambushed police in Baton Rouge. Already, commentators are pointing a finger at Black organizers. Just over a week ago, a Black Lives Matter protest in Dallas ended with a sniper targeting police there. In return, the police circulated an image of an innocent protester as a suspect before using a robot to kill the alleged perpetrator. 2 days before the Dallas shooting, Baton Rouge police killed Alton Sterling while he was pinned to the ground. And the next day, Philando Castile was shot dead by police during a traffic stop in a suburb of St. Paul, Minnesota, while his girlfriend and her 4-year-old daughter sat inches away. For the past 3 years, my job has been to report on Black-led organizing and the police violence that fuels it. And until recently, I've been able to read and process related news with the detachment that my journalism training has instilled in me. But now, what I see online and on TV simply makes me afraid. I am 7 months pregnant, and these days, tragic events hit me in a way that I can't neatly tuck away. I'm learning that in moments like these, it's critical that I step away from the screen and stop crying, that I figure out how to return my breathing to normal. My health and my fetus's health depend on it. Black women, after all, are almost 4 times more likely to die from pregnancy complications than our white counterparts, and Black babies are twice as likely as white babies to die before their first birthday. I worry that I'll have a baby that's too small to thrive, or that I'll be treated so negligently by the hospital staff during delivery that I will end up seriously injured or dead. I shouldn't have to worry. I eat a healthy diet. I don't have high blood pressure or diabetes. I am not poor. I have private insurance and a master's degree. I started prenatal appointments at 10 weeks and haven't missed one. But I'm under no illusion that my class privilege will save me. Research suggests that it's the stress caused by racial discrimination experienced over a lifetime that leads to Black American women's troubling birth outcomes, not the individual choices those women make or how much money or education they have. I have sat slack-jawed as I read the work of public health researcher Arlene Geronimus, who has found that the average Black woman might be less healthy at 25 than she was at 15, and that African American women at 35 have the rates of disability of white Americans who are 55. The American experience tears away at the Black body. I am 38 years old, and so daily slights and structural racism have had plenty of time to take their toll. Thus, my decision that day, made during the long summer of my 3rd trimester, to take a break from the news, which served as a constant reminder of 2 disturbing realities. One, that in carrying a Black child, I was carrying a potential Sterling or Castile or Rakia Boyd or Tamir Rice. And 2, that my health and that of my child-to-be were largely in the hands of people who, like me, had been watching events unfold in Baton Rouge or Dallas or Ferguson or Chicago, but who may have had a completely different understanding from me of how race works in this country. When I walked into my OBGYN's office in Dayton, Ohio, or into the offices of the various specialists I saw over the course of my pregnancy, I suspected that the all-white teams of receptionists, nurses, and doctors, okay, there was one Black receptionist at the office where I got my ultrasounds, but I suspected that these all-white teams first saw a Black woman, not an Ivy League graduate or someone whose job included researching reproductive health, or any of the other characteristics that some may think would shield me from substandard care. An Institute of Medicine report found that people of color, quote, are less likely to receive needed services, end quote, even when their insurance and income are the same as white people's. So I tried to leverage every bit of privilege I could to stave off any assumptions that my healthcare providers might have made. I wasn't married and I rarely wore my engagement ring, but I made sure to put it on before every prenatal appointment. When I showed up to an appointment with cornrows or an afro, I wondered if I'd be treated differently from the times I'd come with my hair flat ironed. These concerns may seem far-fetched, but during my pregnancy, they were very real to me. A 2016 study by the University of Virginia found that about half of the white medical students and residents surveyed held at least one false belief about biological differences between Black and white people, that Black people's nerve endings are less sensitive than white people's, for instance. These were not randomly selected people, mind you, but students well on their way to becoming doctors. Those implicit biases affected their ability to make appropriate decisions about treating Black patients. Dr. Norman Oliver, a co-author of the study and Virginia's current state health commissioner, told me that while the so-called social determinants of health, access to safe housing, jobs, education, health insurance, are largely responsible for health inequities, bias and clinical treatment also plays a role. A 1999 study of cardiovascular health found that Black women are at a particular disadvantage when it comes to receiving adequate care. I'll stop right there.
Well, thank you. I'm just blown away by that. And I would encourage anybody that's looking at the lives of Black folk, take a look at that. I mean, it's also interconnected. We're also, I'm going to turn it over to Darlene again, but we're also looking hard at clinical research, the good, the bad, and sort of the ugly of it, but also the future of it, what it could tell us about us. So, I mean, that's what our sponsoring partner is looking at, trying to include Black and brown folks into the clinical research studies through Join All of Us. Darlene, kick it.
Thank you. Thank you both. Powerful. Dani, we wish you well. We look forward to more of your writing. We wish you well with your daughter growing up. Yes, we'll be looking for more of your writing. Andrea, thank you very much for the informative, facilitating, engaging conversation. It was very informative. And as you mentioned, we really think we're grateful to the All of Us Research Program for support of our reading series and doing the work to raise awareness and advancing medicine. And for this series today, we appreciate the support of organizations, the Black Women's Health Imperative, the Detroit Public Library, Wayne State University, and the University of Washington Communication Leadership Program. And we ask you for joining us. Thank you. And we ask you to take a minute to fill out a quick participant survey. Your feedback is very important to us, and you can find the URL in the comments. And if you joined us and would like to receive 1 hour of MLACE credit, if you registered for the event, will automatically receive an email and tell you how to claim this credit. Otherwise, please email us at nnlm@uw.edu. And you got a little taste of Dani's writing. So I'm hoping that you will participate in a reading club discussion. If you're looking to join one, think about the Detroit Public Library. You're invited to go to their website page and register for their 2-part virtual discussion of her book. And before we send you off, we want you to come back. So we invite you to join us in November when we talk with Bill Sullivan. He's a professor of pharmacology and microbiology at the Indiana University School of Medicine. He wrote, "Pleased to meet me, genes, germs, and the curious forces that make us who we are." You can learn more about his book and find a discussion guide at the NNLM Reading Club website or on his author page. Thank you. This concludes today's NNLM Reading Club Presents.